Yes, brother.
Can you hear me?
Yes, I can hear you.
Yeah.
So now I'll ask Dr. Suresh Raghavia to speak.
Assalamualaikum, everybody. Can you hear me?
Suresh, I'll just come in and then you will.
Please do, sir.
I'm sorry, we have
Yeah.
Dr.
My
Yes, sir. Please go ahead, sir. Please go ahead, sir.
Yeah. The thing is, myself, I'm Dr. Yatish. I represent Apollo Hospitals. It's pleasure to have this meeting and this association forward. Knowing about Apollo, I just want to say, I don't need to say anything much about Apollo, but thing is, all my doctors who are there and the patients who come across and you guys send across, we will be definitely will take care of them as our relatives. That much I'll tell you. We'll expect, we will definitely give the best outcomes to our patients, and during their journey, we will take care of them under the best professional.
Okay, so can I ask Dr. Suresh to start, sir, please?
Yeah. Hi, good afternoon, everybody, and thanks a lot, Sishan, for putting this thing together.
I'm sorry.
Because it's been a great, we've been waiting to actually network with all the patients from Yemen and people from Yemen. We've actually done a lot of transplants for people from Yemen, and our track record has been quite good. So today, I wish to talk to you guys about one of the rarest transplants which is done, which is the pancreas transplant. I'm not sure how many people would have actually heard about pancreas transplants, but we are probably one of the only group in Bangalore or Karnataka which is doing pancreas transplants. So I have no disclosures related to my presentation, and all images I've used with the permission of the patients. And again, thank you so much for the M&E Health Summit to actually give me this opportunity to talk to you guys about the pancreas transplant. So a little bit about myself. I finished my MS General Surgery from St. John's Medical College in Bangalore, and thereafter went to Paris to train under Professor Bryce Guy, who's known as the father of laparoscopic HPV surgery. So I completed my fellowship under him. And then from there went to the US because I was interested in immunology. So I got a postdoc in transplant immunology from Mayo Clinic in USA. And thereafter did the multi-organ transplant fellowship from Mayo Clinic itself. After coming back to India, I've led the HPV and multi-organ transplant team in 3 different hospitals, high volume centers, and currently working as a senior consultant of HPV and multi-organ transplant surgeon in Apollo Hospital. We cover the entire Karnataka region for transplants, and I'm proud to say that our team has done the maximum number of liver and pancreas transplants in our state. So quickly, a brief overview of pancreas transplant talk. We talk about what the incidence of diabetes is. I will talk about the Indian scenario, which I'm fairly sure it's the same in Yemen as well. And we'll talk about the potential for surgical treatment of diabetes, what the recipient selection is, what the donor selection is. We'll talk briefly about my outcomes. So we know that WHO estimates that more than 350 million people have diabetes. It's a huge issue all over the world right now. And if you look at it last year, more than 1.5 million deaths were directly caused by diabetes. And by 2030, diabetes will be the 7th leading cause of death worldwide. So if you look at type 1 diabetes, which is the insulin deficient diabetes, which the pancreas transplant is going to be the curative option for, it's about 5% of the total diabetes population. So which is absolute insulin deficiency with or without glucagon insufficiency. So if you look at the Indian statistics, 5% of 60 million is approximately 3 million people in India are suffering from type 1 diabetes, and more than 1 lakh children who are less than 15 years of age have been identified with type 1 diabetes. And these are the people who are actually going to be helped the maximum with respect to pancreas transplant, the children who are less than 15 years of age. Right. Why is diabetes such a big problem? you know that it has lots of vascular complications, and the longer you have diabetes, the vascular complications are much higher. So if at all you can look at it, if you have diabetes for less than 20 years, the incidence of eye damage and kidney damage are hardly less than 6% both. But if you have diabetes for more than 20 years, the percentage of eye damage and kidney damage increases to more than 20%. And this is where the type 1 diabetes plays its nasty role, where if your children as young as 4 or 5 or 6 years of age develop diabetes, by the time they hit puberty, 19 or 20 years of age, they're going to develop all the vascular complication of diabetes. Now, if you look at kidney disease as a whole, we know that almost 50% of kidney failure right now in the current population is because of diabetic nephropathy. And why is diabetes with renal failure such a complicated issue? If you're a renal failure patient and do not have diabetes, you can look at your survival curve. You have a chance of being alive, more than a 60% chance of being alive at the end of 5 years. But if you have diabetes and renal failure, your survival curve drops really down. In the sense, within about 3 years of having renal failure and in the background of diabetes, your survival is hardly about 40 to 50%. Now, if you look at some cancer survival rates, if you have diabetes and renal failure, your survival is actually much worse than a cancer survival. And what's the best treatment for kidney failure? Absolutely a kidney transplant. It is not dialysis, because if you look at the survival curves of patients with renal failure undergoing dialysis versus who undergo transplant, at the end of 5 years, more than 80% of patients who undergo kidney transplant are alive, as opposed to about 40% of patients who continue on diabetes. Now, the problem with undergoing a kidney transplant for renal failure with diabetes is these curves. Okay, so this is the survival of the kidney transplant. Let us say you undergone a kidney transplant and you're not doing anything for the diabetes. This diabetes is going to also affect the transplanted kidney, right? Just like it had its bad effects on the native kidney, the transplanted kidney is also going to undergo damage. So if at all you look at this, so this is the survival of the kidney transplant if you do not have diabetes. Let us say you have focal segmental glomerulonephritis, some infection, some interstitial nephritis, you lost your kidney and you underwent a kidney transplant. Now that transplant, more than 90% of those kidneys will survive for at least 14 years. They will still keep functioning. But if you're diabetic, what happens? That because of the recurrent disease in the kidney starts to fail. So if you are lucky enough to have a living donor and have a living donor kidney transplant, about 70 to 80% of the kidneys are still functioning at about 10 years. Whereas if you have a cadaveric kidney transplant, less than 50% of them will be functioning at about 10 years. Now imagine if you're a diabetic, you got a kidney transplant, but also get a pancreas transplant. So what is SPK here? SPK means simultaneous pancreas and kidney transplant. You can look that this kidney is going to survive much, much longer. So what these two stars means, there is no difference between the survival of the kidney over here. So if you get the simultaneous pancreas and kidney transplant, the longevity of the kidney transplant goes on forever. So matches that of a transplant where you've done the transplant for non-diabetic causes. More than 80-85% of the kidneys are functioning at the end of 14 years. Now, what does this translate to? This translates into patient longevity. If your kidney is functioning well, if you've gotten rid of your diabetes, you tend to live longer. So this is what this is. So if at all you get a kidney transplant alone, your survival curves are this one. Whereas you get a simultaneous pancreas kidney transplant, more than 80-90% of the patients are alive at the end of 8 to 10 years. And this graph suggests the same thing. If you look at the patient survival, if you're a diabetic, if you're only on dialysis, you do very poorly. If you get a cadaveric kidney, you do better. If you get a live donor kidney, you still do better. But the best survival for a patient with diabetes and renal failure will be a simultaneous pancreas and kidney transplant. Now, why is this? Because once you get your pancreas transplant, you're cured of your diabetes. Now, all the long-term effects of your diabetes or poor sugar control, like nephropathy, retinopathy, angiopathy, or increased risk of stroke, increased risk of diabetes, all of those things disappear once you get a pancreas transplant because you're no longer a diabetic. And this is the reason why the patient survives for such a long time after getting a successful pancreas transplant. So what does this generally mean in summary? If you are a simultaneous, diabetic with a renal failure, instead of considering only a renal transplant, please consider a simultaneous kidney and pancreas transplant. Now, a pancreas transplant is not something new. In the US, more than 18,000 pancreas transplants have been done. In the Europe, more than 5,000 transplants have been done. But if you look at India, we are still less than 100 with respect to pancreas transplants, right? So now let's look at the various types of pancreas transplants we can do. We can do a simultaneous pancreas kidney transplant. So what does that mean? The patient has renal failure. Patient has lost his kidney because of diabetes. He has come for a transplant evaluation. So we counsel the patient, since you need one transplant, might as well do both the transplants at the same time, both the kidney and pancreas transplant at the same time. Now, what is the advantage of this? The patient has to undergo only one surgery, and the same medications which the patient would have taken after kidney transplant, he will take after pancreas transplant. There is absolutely no change in the medicines which the patient will have to take. You can also do what is known as a pancreas after kidney transplant. Now, who are these patients who undergo pancreas after kidney transplant? Let us say a patient has renal failure, but he does not want to go on dialysis. He hates dialysis. So in those patients, what do? We do a living donor kidney transplant first. Then we wait for about 3 months' time and then go ahead and do the pancreas transplant, which is called as a pancreas after kidney transplant. Now, in some patients, they do not have kidney failure, but they have lots of other complications of diabetes, like hypoglycemia. They fall down because of poor sugar levels. Their sugars are not getting under control. They have severe retinopathy, which is leading to blindness. Or a lady who's married is not able to have children because of a poor control of diabetes. So in these patients, we can consider what is known as pancreas transplant alone, where instead of doing a pancreas and kidney transplant together, we just do the pancreas transplant alone, and this will cure her of her diabetes. And generally, when we do a simultaneous kidney and pancreas transplant, we usually place the kidney on the left side and the pancreas on the right side. So this is how a pancreas looks like just before transplant. Unfortunately, for lack of time, I'm not going to show you a video. We do a pancreas transplant, but suffice to say that we take the pancreas from the donor, including the loop of intestine, and this is the entire length of the pancreas. This is the venous drainage of the pancreas, and this is the arterial supply of the pancreas, which we go ahead and implant it into the recipient. Now, the advantage of becoming a pancreas donor is that we get a young age donor always. We do not take any donor who is more than 35 years of age. So generally what happens is we get a very young organ, healthy organ, which is going to last for a long time. And these are just a few surgical pancreas transplant. Now, a pancreas transplant does have its risk, in the sense the most important being that the vascular graft can thrombose, which is called portal vein thrombosis. And in order to prevent that, we actually give them heparin, and as a consequence of which the patient might be at a little bit of bleeding after the transplant. Now, along with that, there is a bit of pancreatitis can happen, wound infection can happen. They might need a second operation to treat all of these things. But by and large, the results of pancreas transplants are very good. And obviously, the patient will have to stay on immune suppression lifelong. But either way, even if he got a kidney transplant, he would have done. So just a little bit about my personal experience. That's 52 pancreas transplants till now, which is highest in the state and probably second highest in the country. Our team, other surgeons are also there who do pancreas transplants. The total team has done about 76 pancreas transplants right now. If you look at Apollo Group as a whole, we have done the maximum number of pancreas transplants in India and maximum number of transplants in Karnataka state, which is our home state. So generally, if you look at the patients who come for pancreas transplant, they are between the ages of 20 to 30 years of age, because this is when diabetes would have come in young age, when they were very young. and all the complications would have taken about 10 to 12 years to develop. So between the ages of, I would say, about 20 to 35, when they're supposed to be at the peak performance status of their life, they unfortunately come with all their complications of diabetes, and that is when they come and get treated. So we have actually had our fair share of complications. We've had to reoperate on 6 of these people for abscesses and leakage and everything. We've had one renal failure due to FSGS coming back immediately after transplant, and unfortunately, we have lost one patient because of severe allograft pancreatitis, and actually the patient donor had multi-drug resistant Klebsiella, which was not picked up, and all 3 patients who received organs from the donor actually passed away. But by and large, we have not had any post-surgery.
I'm sorry to interrupt. Sir, I'm sorry to interrupt. They wanted to ask few questions, sir.
I have 2 slides to go. Can we do the question session after that?
Yes, sir.
Okay. So the advantage, everybody says, what is the advantage of pancreas transplants over the case is a treatment for diabetes. But if you look at the 5-year and 10-year insulin-free rate, where the patient has to go back on insulin, if you look at islet cell transplants, only 70% of them are insulin-free at the end of 1 year, whereas at 5 years, less than 10% of them are insulin-free. But if you look at the pancreas transplant data, 80% of them are free of insulin 1 year, and at 10 years, 50% of them are free. But that was old data. If you look at the recent data, 75% of the patients are cured of diabetes at 10 years. We are still waiting for this decade's transplant data to come, but as far as I know, the most recent publication quotes 82% of patients who had a successful pancreas transplant are still free of diabetes. Now, what is the advantage of being diabetes free for that long? Again, all your complications of diabetes gets postponed, and most importantly, if you look at the patient survival, they survive for a very long time. So these are just some of the few photos of patients I want to show. So this is Shekhar Milani, the first transplant patient I did in India after coming back from Mayo Clinic. And this is him now. You can see that the nutritional status improves of the patient so much. About 4 years, we got into the papers because it was the first one in the state. These are other patients. This is Marjabin, who's a dentist. This is Shahjabin, who is a Japanese translator of Accenture. This is Praveen, who's a chemical engineer. This is Mamta. You can see, so these photos are 6 months apart. And I keep joking that the nutritional status of both the patient and the surgeon improved in 6 months after pancreas transplant. Now, this is absolutely the #1 reason why you need to get a pancreas transplant if you're diabetes. You can see what he's eating over here. So this is what is called as death by chocolate, which is probably the highest amount of chocolate and ice cream which you can buy over here in Corner House. Imagine a patient with diabetes who was going to eat this. You know, you have a lot of dietary control when you have to treat diabetes, but once you have a successful pancreas transplant, you have absolutely no dietary limitations. And this is Aishwarya over here, who's eating gulab jamuns. You know, you can drink sugarcane juice, you can eat chocolate, you can eat ice creams, everything, if your pancreas is going to work well. And like I told you, India's first patient who delivered a baby because of infertility after pancreas transplant, because of poor control of diabetes, she was not able to deliver. And this is India's first simultaneous pancreas and kidney transplant patient who delivered a healthy baby boy, Kaustuba. And this is Imran over here, which we did in Mysore, enjoying some cake immediately after his transplant. Okay. So the key points being simultaneous pancreas and kidney in type 1 diabetes and renal failure will improve both patient and kidney graft survival. Successful pancreas transplant will result in insulin independence in all patients with type 1 diabetes. Of course, there are risks involved, but the benefits of successful pancreas transplant outweigh such risks. So just a quick plug for our team. This is our wonderful team over here in Apollo. We do cover the entire region of Karnataka for all transplants. We are obviously the best HPV and multi-organ transplant team in Karnataka, if not all over India. Our boss, Dr. Sanjay Goel, is the president of the Indian Hepatobiliary Pancreatic Association. We operate on all kinds of cancers, of the liver, gallbladder, biliary, and pancreas cancer. We have the most exhaustive experience in dealing with hepatobiliary cancers. And we are a multi-organ transplant team. We do liver transplants, kidney transplants, pancreas transplants, and small intestine transplant. And we are one of the very few teams which deal with both with adult and pediatric patients. So we had an excessive, we got an excellent track record with when it comes to this one. And we'll be very happy to take care of patients from Yemen. Thank you very much for your attention. And Sishan, I'll be very happy to take questions. Thank you.